Dr. Trent Richards, an ophthalmologist in the Tanner Clinic in Layton, Utah. I focus on all medical and surgical treatments of ocular disease, specifically any cataracts or eyelid disease, droopy eyelids, floppy eyelids, any exposure issues with your cornea leading to dry eye, glaucoma, or refractive surgery like LASIK or PRK.
Dr. Richards performed PRK laser eye surgery on me. Before the procedure, my vision was pretty awful. I couldn't see at all, so I'd keep glasses next to my bed in the morning. And then in college, I couldn't read the whiteboard. It didn't matter how close I sat to the front of the room, I just couldn't read it. So I was always asking the professor to give me the presentation after class, so it was really hard to deal with.
My contact prescription was -4. I always had to be wearing contacts or glasses to see anything. I'd mostly heard of LASIK, but I was worried because I had dry eyes, and so knowing that PRK is more for people with dry eyes, it helped me reassure me to do the procedure.
So with LASIK and PRK, you're using a laser to shape the eye to be able to allow the eye to see without glasses. It's a very quick surgery, and we use actually a little eyelid speculum or eyelid holder that allows you to keep your eye open, so you don't have to do anything to maintain your eyelid open. And then you really just look at a light and you really don't even know what's going on because you're just looking at a bright light and you don't feel anything because you're completely numb.
My overall experience through the process was really great. From the beginning to the end, it was just a really easy process for me, and the surgery was really great, and Dr. Richards made me feel really comfortable the whole time, and I had minimal pain, no pain as far as I can remember, and I also recovered really, really quickly.
I was really worried because you don't mess with your vision or eyes, but I didn't need to worry because the procedure took 10 minutes. It was no big deal at all, and then the recovery was 3 to 4 days, and that was it, and I haven't had to worry about contacts or glasses again. I love outdoor activities, so biking, running, walking, and not having to worry about contacts or glasses doing those activities is so amazing. But my favorite part is not having to wake up and poke myself in the eye, or getting that headache at the end of the day when you've been wearing glasses all day.
So my favorite thing that I tell people is that, and it sounds really simple, but I can wake up in the morning and open my eyes and I feel awake. I don't feel foggy and groggy, and I don't have to reach for my glasses, and I can see the alarm clock. So that's my favorite thing.
The surgeries that you're able to perform as an ophthalmologist and how they can change people's lives, that's what made me want to go into ophthalmology. My favorite part is that you get to see the patients for a long period of time, so you get to know the patients and you get to know their family as well, because a lot of times you'll see the whole family, the grandparent, the great-grandparent, the parent, the kids. We're able to treat everybody from birth to basically, the 100-year-old with cataracts or macular degeneration. And so you get to know families very well, and then also the surgery that you're able to perform, and when you can restore eyesight is pretty amazing. Having somebody come in who's blind and be able to perform a cataract surgery and they walk out of the operating room being able to see is pretty spectacular.